Hi everyone, my name is Emily Gray, and today we're going to be looking at a paper titled Overproduction of Growth Differentiation Factor 15 Promotes Human Rhinovirus Infection and Virus-Induced Inflammation in the Lung. First, we should talk a little bit about chronic obstructive pulmonary disease, or COPD. COPD is a major medical issue in the United States as it is currently the third leading cause of death. COPD is caused by long-term exposure to toxic particles found in cigarette smoke. COPD is characterized by poorly reversible airflow obstruction and abnormal inflammation. All smokers have inflammation within their lungs as a normal response to toxic chemicals that they're inhaling. However, an individual with COPD has enhanced or abnormal inflammation to these particles. Those with COPD typically have an increased inflammatory environment within their lungs. The inflammatory environment leads to various physiological abnormalities that are seen in patients with COPD. Some of the most critical of these includes the hypersecretion of mucus, which causes a chronic cough that is commonly seen in patients with COPD. Another physiological change is gas exchange abnormality, and this impaired exchange of oxygen and carbon dioxide in the alveoli can lead to decreased oxygen levels in the blood, which ultimately leads to oxygen deprivation of other organs. Those that have COPD often suffer from exacerbations, which are more or less a worsening of their symptoms. Typically, these exacerbations are caused by a viral infection in the respiratory tract, and there's a worsening of gas exchange and an increased inflammatory environment, among other symptoms. Exacerbations are very deadly and can lead to respiratory failure and death. So human rhinovirus, or abbreviated as HRV, is the most frequent cause of the common cold, and it's typically associated with upper respiratory tract infections. Symptoms of an HRV infection typically include nasal stuffiness, sneezing, coughing, and a sore throat. However, those who have chronic underlying conditions, such as those with COPD or asthma, are prone to getting an HRV infection in the lower respiratory tract, and HRV is the most common virus associated with COPD exacerbations. When HRV enters the respiratory tract, its primary entry is through airway epithelial cells, where it is able to replicate and be released. It elicits an immune response that typically increases the production of inflammatory mediators while also increasing the production of interferons. And it's important to keep in mind that interferons are an important aspect of antiviral immunity. Additionally, I want to touch on this growth differentiation factor 15, or GDF-15, which will be essential to the study we'll be looking at today. GDF-15 is a cytokine of the transforming growth factor beta family, and it's typically expressed in very low concentrations under normal conditions. Researchers believe that GDF-15 function may be to suppress inflammatory responses in a protective way, as it is a stress-responsive cytokine. It increases during inflammatory states, and it's expressed in a wide range of cell types. However, the exact mechanism that GDF-15 works by remains poorly understood. One of the stimuli that increases GDF-15 includes cigarette smoke, which is why GDF-15 is seen to be upregulated in the airway epithelium of patients with COPD. So to summarize this information in the context of the question we'll be asking today, we saw that human rhinovirus is the most common virus causing exacerbations of COPD. And we also saw that GDF-15 is upregulated in the airway epithelial cells of COPD patients, which is where HRV commonly infects. So today we'll be asking the question, does GDF-15 promote HRV infection and virus-induced inflammation? So let's talk a little bit about the experimental setup. The researchers in this study used a transgenic mouse model that constitutively expresses human GDF-15, and they compared it to wild-type mice throughout the study. They then either infected these mice with the HRV-1b for 24 hours, or they did not infect these mice as a control. So after the infection for 24 hours, the mice were killed and the researchers measured a few important things. The first being the viral load of HRV to essentially determine the amount of HRV released in the lungs after infection. And they then measured the amount of interferon lambda 2,3 in the lungs, which is the mouse interferon analogous to the interferon in humans in response to HRV. And they then measured inflammation by measuring inflammatory cells, particularly focusing on neutrophils today, and they also measured the level of pro-inflammatory cytokine IL-6 following the infection. The researchers in this study hypothesized that the mice expressing human GDF-15 will have an enhanced viral infection, and they will also have greater levels of inflammation within the lungs after HRV infection. The first figure that we'll be looking at today was measuring the HRV load in the lungs after the 24-hour infection. So on the figure to the left, we have on the x-axis the wild-type and transgenic mouse expressing human GDF-15. Both of these were treated with HRV1b. On the y-axis, we're looking at the HRV load that was measured from the bronchoalveolar lavage. In comparing these two groups, we see that the mice expressing human GDF-15 had a significant increase in the release of HRV after 24 hours, indicating that in the presence of GDF-15, the viral load increases. When looking at the second graph on the right, the researchers were measuring the interferon levels. So on the x-axis, we're looking at wild-type and transgenic mice that were either treated with a control or treated with HRV1b. The significant result to look at here is between the wild-type and transgenic mice that were infected with HRV. And we see that there's a significant decrease in the relative interferon levels when GDF-15 is expressed. And if you remember from before, interferons are important in eliciting an antiviral immune response. So the decrease in interferon lambda 2,3 in the presence of GDF would enhance the viral infection. The third figure we're going to look at today was measuring the neutrophils present in the bronchoalveolar lavage after HRV infection of these mice to determine if there was an increased inflammation in the lungs. So in the first figure, we have the x-axis with both wild-type and transgenic mice that were either treated with PBS as a control or treated with HRV1b. And on the y-axis, we're measuring the concentration of neutrophils in the lungs. So when comparing the wild-type and transgenic mice that were treated with HRV1b, after 24 hours, we see there's a significant increase in the neutrophil level in the mice expressing GDF-15, indicating there's an increase in inflammation. In addition to the neutrophil levels, the researchers also measured the levels of pro-inflammatory cytokine, IL-6. And on the x-axis, we have the wild-type and transgenic mice again that were treated with PBS or the HRV1b infection. And on the y-axis, we have the concentration of IL-6. So when comparing the wild-type to transgenic mice expressing GDF-15, we see that the transgenic mice, there's a significant increase in the pro-inflammatory cytokine IL-6 in the lungs. So both of these results are indicating that there's an exaggerated inflammatory response to HRV infection when GDF-15 is present. So just to summarize the results of this study, we saw that expressing human GDF-15 in mice enhances HRV infection, and we saw this when there was a significant increase in the HRV load in the transgenic mice. We also saw that there was a significant decrease in the interferon levels in the transgenic mice compared to wild type, and we know that this interferon is crucial to antiviral immunity. We also saw that GDF-15 expression in the mice increases the HRV-induced inflammation in the lungs, and we saw this by seeing an increased level of neutrophils as well as IL-6 in the transgenic mice. So just to put these results together, we know that GDF-15 is increased in patients with COPD. And we just saw that in this mouse model, GDF-15 is leading to an increased HRV infection and inflammation in these mice compared to wild type. So by understanding GDF-15's role in HRV infection and inflammation, could we potentially apply this to COPD patients? So the first question I have today is, in this study, the researchers used a transgenic mouse model to conclude that GDF-15 increases HRV infection and lung inflammation. So as a researcher, what would you propose as the next step to study GDF-15's effect on HRV and why? And second, knowing the relationship between GDF-15 and HRV infection and the result that HRV has on the lungs, what are some potential ways to prevent this exacerbation from occurring from a clinical perspective?